Welcome to Radi Us, our University of Manitoba Radi Faculty of Health Sciences monthly podcast, where you get to catch up on the headlines from the past month and meet our faculty, staff, and learners making news. We'll also be engaging with our Radi community beyond our campuses, so be sure to listen for alumni and partner voices too. The Roundup for the month of August 2025 includes stories about the inaugural exercise ceremonies for new healthcare students, a new study on the use of antidepressants for children and youth, the Canadian Medical Hall of Fame Student Awards, and more. I'm Jonathan Wilson from the Radi Faculty Communications and Marketing team.
Dedicate my life to the service of humanity. The health and well-being of my patient will be my first consideration. I will respect the autonomy and dignity of my patient. I will maintain the utmost respect for human life. I will not permit...
Over the past few weeks, the Radi faculty's colleges have held special events to officially welcome their new students. The ceremonies the learners took part in mark the start of their journeys as healthcare professionals in training. At the Max Rady College of Medicine's inaugural day exercises, Jesse McGregor and his classmates were each presented with a white coat, signifying their entrance into medical school. McGregor is originally from Mississippiwistic Cree Nation and grew up mainly in Kinnisaw Sippy Cree Nation. He said he wants to become a physician because he would like to give back to the communities that built him into who he is today.
I'm from the north, and I am proud of my identity as an Indigenous person, and I want to be able to be an Indigenous family physician and give back to the north and commit to that ongoing journey of reconciliation of the healthcare system and making sure that our people feel cared for in a way that they feel understood and that they feel heard.
Students from the Dr. Gerald Nisnik College of Dentistry and School of Dental Hygiene took part in the opening assembly. Dental hygiene student Rafael Cristobal said that reciting the community code marked a transition from being a student to becoming a healthcare provider.
Overall thoughts on the ceremony, it feels surreal, and I can't wait for the relationships and moments that this program has in store for me.
Future pharmacists took part in the College of Pharmacy's White Coat ceremony, where they recited the Pledge of Professionalism. First-year Doctor of Pharmacy student Cherry Nguyen will be the first member in her family to pursue a healthcare profession. The event was an emotional experience.
It was such a surreal moment. It's truly a dream come true, one that I never imagined would be possible. I'm still a little bit shaky from the event, as you can tell. Becoming a pharmacist has always been something that I've been dreaming of.
At the Master of Physician Assistant Studies inaugural exercises, Yuxi Ramirez and her classmates were each presented with a stethoscope, which represents the relationship between the practitioner and the patient. Ramirez said that the stethoscope ceremony was the most exciting moment in her life.
There was a lot of excitement and just pure happiness of being able to contribute to such an amazing program. So I was honestly beyond stoked to be up there, and I just hope to make the program proud in the future as well.
The College of Nursing and Midwifery program held events to welcome the incoming students, and the College of Rehabilitation Sciences also held welcoming ceremonies for the respiratory therapy, physical therapy, and occupational therapy programs. This summer, the Rady Faculty of Health Sciences welcomed two new deans. First, Dr. Hope Anderson was appointed Dean of the College of Pharmacy. She's a professor at the college and a principal investigator at the Canadian Centre for Agri-Food Research in Health and Medicine at the St. Boniface Hospital Research Centre.
On behalf of the College of Pharmacy, we're excited to put the College of Pharmacy on the map. And the map is whatever it is, right? Here within Rady at the institution, at a provincial, national, international level. All we really have to do is create systems and processes, because each individual member will do it themselves. There's so much talent here. We just can't wait to facilitate that.
Joining as the inaugural dean of the Rady faculty's newest college, the College of Community and Global Health, is Dr. José Lavoie, a professor of community health sciences.
Our work is very unique. We are a college dedicated to systems transformation. We are an incredibly vibrant environment that is also broadly networked with Manitoba Health and other government departments, with the federal government and community organization. If you want to see your work having impact, this is the place to be.
Akil Ramdoyle, a third-year medical student at the Max Rady College of Medicine and former geologist, was one of 16 students across Canada recognized with a Canadian Medical Hall of Fame award this summer. The award honors exceptional medical students for their academic excellence, leadership, communication skills, and dedication to advancing medical knowledge.
Receiving the CMHF award is incredibly humbling. It affirms to me that lived experience, community advocacy, and academic curiosity all have their place in shaping the future of medicine. Coming into this profession from a non-traditional background, it is meaningful to have my contributions around health issues and outcomes in Manitoba be recognized at this level. It encourages me to keep elevating the voices of marginalized communities. My hope is to practice medicine in a way that helps build bridges between patients, communities, and institutions to help shape a healthcare system that works for everybody, that's equitable and responsive. I hope to show up fully for my patients and not lose track of the systems that shape their health and our future.
An estimated 1.2 million children and youth in Canada are affected by mental illness, with depression, anxiety, and OCD among the most common disorders. A Toronto Star investigation found a 240% increase in antidepressant prescriptions for Canadians under 18 between 2009 and 2019, driven in part by long wait times for therapy and counseling. While antidepressants are often effective and well tolerated, they don't work for everyone, and some children and youth experience unwanted side effects such as hyperactivity, impulsivity, irritability, and insomnia. Dr. Abdullah Marouf, assistant professor at the University of Manitoba's College of Pharmacy, is leading a research initiative to better understand how children and youth respond to antidepressants. Dr. Marouf spoke with CTV News Winnipeg about the study.
There are two groups of kids. So some kids take this drug, they are tolerating it well, they are getting the benefits, and another group isn't getting the benefits or experience adverse effects, which ultimately leading to they discontinue the drug. So we want to compare the genomic profile and hopefully or potentially want to find out if genetic variants amongst us can answer why some kids are tolerating it well compared to the kids that are not benefits from this drug. So we can develop or personalize some genetic tool that can be used, or we can give it to the healthcare providers to personalize these medications to find out the ideal antidepressant or the drug or the dose, or maybe in some cases an alternative option for kids who are at risk of developing adverse effects due to these drugs.
The research team is currently recruiting participants aged 6 to 24 who have taken antidepressants for depression, anxiety, or OCD. The goal is to personalize treatment in Manitoba and beyond. To learn more or to register, please visit maruf-lab.org/pgx-simba or call 431-294-7781. For the first time ever, the Physical Therapy Department at the College of Rehabilitation Sciences held an Indigenous welcoming ceremony for all students, faculty, and staff as part of its student orientation. The ceremony was held on August 5th on the Bannatyne campus. 52 second-year students attended, along with 60 first-year students, who make up the largest incoming class in the program's history. The department said the ceremony was held as a way to decolonize the classroom and recognize the college's role in working towards reconciliation. The event included a pipe ceremony led by knowledge keeper George Muswagon and Elder Charlotte Nolan, both from Ungamazin Indigenous Institute of Health and Healing at the Rady Faculty of Health Sciences. Nolan welcomed the students and reminded them that many of the people they care for in their careers will be Indigenous.
It's an honor for me to be here with you to share in these ceremonies so that you begin to learn who we are as Indigenous people. You begin to understand what we're about, what we feel, what we love, what we look after. Growing up, I was taught like you live on the land. Later on in life, I learned that we don't live on the land. We live with the land.
The event also included a water ceremony and offering of berries led by Chantel Daniels, Director of Angamasin Education. Daniels was assisted by Chris Trimble, Indigenous Cultural Coordinator, Andrea Young, Indigenous Student Support, and 4 student volunteers. First-year student Tristan Hutter was among those volunteers. He said the ceremony gave a meaningful start to his student journey and that he looks forward to learning about physical therapy over the next 2 years.
I look forward to the fact that it is very needed in today's society. So we were just also told this morning by one of the staff members that there's actually a shortage of physiotherapists in the province. So I feel that I have an amazing opportunity and a privilege of being kind of part of that solution, of filling that role where that role is definitely needed in today's society in the healthcare field.
Nearly 100 medical students spent the summer working on their very own research projects. As part of the Bachelor of Science in Medicine program, or the One Summer Research program, first and second year students learn the skills needed to become future clinician scientists. Tamara Singh spent the past 2 summers focused on better understanding the sex-related differences in the development of rheumatoid arthritis. She said it's important for medical students to gain hands-on research experience.
I think all of medicine is based in like rigorous scientific research, and I think if you don't appreciate that, and let's say a patient comes to me and say they're diagnosed with rheumatoid arthritis, and I say, okay, according to clinical guidelines, we need to start at this treatment, and once you cross this threshold, we'll start on this treatment. I think there's a disconnect if number 1, the provider, and number 2, the patient doesn't understand why there's those benchmarks. They're there because they're based off of a lot of rigorous scientific research.
Jai Saring spent his first summer in the Bachelor of Science in Medicine program, also known as the BSc Med program, working on a project that's focused on better understanding what causes fatigue in patients with inflammatory bowel disease. Saring said the program has increased his interest in conducting research after medical school.
The BSc Med program has helped me feel more empowered to pursue research because I feel so supported with my team, and that has helped me be able to pursue my own interests. So outside of the BSc Med program in gastroenterology, I'm working on a few other projects as well. So I've kind of learned the initiative to contact different supervisors in areas that I'm interested in.
Thanks for joining us today. What did you think? Send us your ideas and feedback to radymarketing@umanitoba.ca. Read more about this episode's stories by visiting our UM Today Rady Network news site at news.umanitoba.ca/network/Rady Faculty of Health Sciences.